Thank you, Mr. Chair, and thanks to the witnesses. Is it Palmieri or Palmieri?
Whatever you prefer, Senator.
No, but I want to do what you want to do.
We pronounce it Palmieri.
Palmieri, thank you. You referenced that your grandfather was a coal miner in Pennsylvania. Great-grandfather, I'm sorry. And I resonate with that because Virginia has a lot of coal mining communities. In fact, I was with a lot of our miners in Abingdon, Virginia for a big event that just took place last Saturday. These miners work to keep our lights on and keep the country running, and it's led to a significant black lung epidemic in the country, which is well known. But what isn't so well known is that the black lung epidemic is particularly hard on the East Coast because of the kind of coal that's mined and the circumstances under which it's mined. A study was done between 2013 and 2017 in Southwest Virginia. My wife's family is from Southwest Virginia. Over 400 miners were identified as having progressive massive fibrosis, which is a very complicated form of black lung. It was the largest cluster ever reported in the scientific literature. And one of the things that's most concerning is the age at which people are getting this really advanced form of black lung disease is getting younger and younger and younger. So it wasn't uncommon to meet a retiree or somebody who is suffering from that. Tragic, but not uncommon. It's now more and more common to find miners in their 30s who have been diagnosed. Researchers have found that exposure to silica dust is causing severe and complicated forms of black lung disease, but also opening up people for other respiratory issues as their immunity weakens. So, for example, COVID was really bad in this part of Appalachia because people already had respiratory challenges. At many of our urging, the Mine Safety and Health Administration finalized a rule last spring to reduce miner exposure to silica dust. And the goal of the rule was to reduce respirable crystalline silica exposure, and it was projected to save 1,000 lives and prevent another 3,700 cases of silica-related illnesses. This was a long-standing effort that was undertaken with all stakeholders at the table. Coal mines were supposed to come into compliance with the rule by April, but it's now tied up in legal proceedings in the Eighth Circuit. And obviously the circuit will decide what the circuit is going to decide. And I hope that they decide that the silica standard is enforceable. But there was also on July 1, MSHA posted an agenda that really focused on deregulation. Didn't mention the silica standard specifically, but it really focused on the goal of deregulating a lot of aspects of MSHA's work. You indicated that President Trump is pro-worker president. Given your family history, if the court action is resolved in a way that upholds the silica standard, will you do everything you can to protect it so that our miners are protected?
Again, I'm not yet at the department, but if confirmed, I would absolutely commit to helping to ensure that the work of the Office of Policy supports the implementation of that standard.
Thank you. Have you had any discussions with administration officials in preparation for your nomination or discussion about this hearing today about the silica standard in particular?
I have not.
And separately from discussions you might have had with them, is this something that you have followed the development? Because it's a first time ever silica standard. I mean, it had been probably needed for a long time, but it was sort of a big step forward to finally have one. Had you separately followed that?
At times throughout my career, a silica standard, an OSHA silica standard more than the MSHA silica standard had absolutely crossed my path.
Okay. I appreciate your commitment to try to protect our miners, and with that, Mr. Chair, I yield back.